is for mobility of the talocrural joint. It's called the Talar swing test. It's a great test, one of my favorites. So what we're going to do here is we're going to try and assess plantar flexion and dorsiflexion of the talocrural joint all in one fell swoop. Okay, we can also assess end feel and determine whether or not there is actually a capsular limitation as well, all with this one test. So the idea here is initially to get a table that's up high enough for us, but that's not what we're dealing with this weekend. So the whole idea of this test is we want to get our thumbs right on the front portion of the talus, like that. My index fingers are going to wrap around to the posterior elements here, so to the posterior tubercles, and then the idea is to keep the bottom of the foot parallel to the ground throughout the whole test. Okay? Reach forward just a little bit more. This will be on the foot. Okay. So we're going to start here, foot parallel to the ground. We're going to push back into dorsiflexion, assess the end feel. We can assess conjunct rotation in that position, and then we're going to pull forward into plantar flexion, assess end feel, and the conjunct internal rotation. Okay? If I find a restriction, I'm going to assess that end feel, but then if I feel a capsular limitation, I'm going to bring them back to neutral here, and then I'm going to take my hands and press straight down toward the floor to test distraction of that talocrural joint. Okay? If I have a capsular end feel and a loss of distraction, we know it's the joint capsule. Okay? You should also have a relative greater loss of plantar flexion than dorsiflexion. There will still be a limitation of dorsiflexion proportionately, it just won't be as severe as it is of plantar flexion. Okay? So if I'm documenting this test on my paperwork for the day, I'll say positive Talar swing with pathomechanical end feel into dorsiflexion. Or I would say positive Talar swing with capsular end feel in dorsiflexion DF/PF with loss of traction or distraction, whichever you want to use. We all good there?